Well, welcome. I'm Karen Gibler with the Sarpy County Chamber. I am joined with Kevin Hensel with the Bellevue Chamber and Jim Janicki with Hillcrest. And today, Kevin and I would like to discuss with Jim about Hillcrest and how we are managing some of the seniors and actually all the activities that are going on with Hillcrest. So welcome, Kevin and Jim.
Hi, everybody.
Well, hello. Thanks for having me.
Yes. So Jim, why don't you give our audience a brief overview on all the different things that Hillcrest actually does?
Well, Hillcrest is a fully integrated health system. So we have independent living, assisted living, long-term care nursing homes, rehab, home care, hospice, adult day services, and outpatient physical therapy. So just a few things. We're one of the largest providers in Sarpy County and actually in Nebraska. We have 1,600 team members. We take care of over 1,500 seniors every day.
Well, seniors are a hot topic right now, aren't they? So let's go ahead and, well, first of all, we want to thank you for your partnership.
Yeah, they should.
Support for the Sarpy Chamber and the Bellevue Chamber. You guys are very community involved, not only just taking care of the people that use your services, you're supporting organizations like both our chambers of commerce so that we can help additional businesses in the community. So thank you.
Thank you.
And so now let's go ahead and jump into the topic of seniors. Tell us about what's going on in your facilities and your.
You know, obviously, we're pretty busy in the senior services world right now. Nobody's twiddling their thumbs, I assure you. It's a matter of keeping people safe, and that's really what we're focused on. And so we've put new restrictions in place in all of our service lines that follow the guidance of the CDC. And we also work with the Nebraska Healthcare Association, and they provide the guidance that comes down nationally that says we really just can't have visitors in our building unless they're absolutely medically necessary. So in our nursing homes and assisted living facilities, we don't have any visitors from the outside unless it's an end-of-life situation of family members coming in really honestly to say goodbye to their loved one, which is a sad situation. But otherwise, casual visitors aren't able to come in. So our activity departments and recreation departments have had to get really creative. And how are they going to continue to engage seniors? Because, excuse me, we don't want people to be depressed, feel isolated, or anything like that. So we're trying to be as creative as we can, and we're doing hallway bingo. We're doing using our in-house channel in order to, we're showing live performances from another area of the community. We're doing just about everything you can think of, even providing puzzles and word games and other things to keep people engaged. But it's all about the safety. In addition, with our team members, when they come on for their shift, before they have to all come through the front door, and before they can even go on the floor, they have to get screened at the front desk. They have to answer questions about their health. If they have a cough or a sore throat or a fever, they get their temperature taken. Anybody who has a temperature at 100.4 or higher is sent home, and we monitor them, and they have to be clear for 2 days before they can come back. That's again following the recommendations of AHCA. So we're really looking to keep people safe. We know there's been some not outbreaks, but a few facilities in the Omaha area that have been dealing with COVID in their buildings, and our hearts go out to them. This is, it's almost inevitable, but we're doing our absolute best to do what we can to keep people safe and just restricting as much as we can the interaction. So it's an ongoing challenge, but our team is just being as diligent as they can to try to keep people safe, but still keep them engaged and have fun with it. And one thing I'll add is it kind of feels like, when I was growing up in Buffalo, New York, we dealt with blizzards a whole lot. And so there'd be times where I couldn't leave the house for 4 days because we had 5 feet of snow. And so then, my mom had to find ways to keep my brother and I entertained, alone in the house for 5 days. And so it's kind of like that a little bit. Our team just kind of pitches in and figures out how can we make sure people are still having fun even though they can't have a lot of contact with the outside world. And so it's been an opportunity for creativity.
Well, I did see that you guys posted, and we did share that you're looking for some pen pals and stuff like that. So you're inviting the outside community in to correspond with some of the residents and people that you're servicing. And that's a really neat idea. Kevin and I were sharing that on one of our chamber calls, and it's definitely taking some momentum. And so your thinking outside the box is really spreading across, the area. We would like to also know if there's any other thoughts that you may have for outside the community and how they can continue to support and keep them. Do you need any art supplies? Do you want to continue to encourage that outside interaction via letters or emails, or anything that you would like to say to our audience today that would help your staff?
Well, I appreciate that, and thanks for the offer. So we created an email address, letters@hillcresthealth.com, and we're utilizing letters@hillcresthealth.com for people to go ahead and just send notes of encouragement. In fact, I have 2 of them right here, and it even starts off just saying, "Hello, dear one. I hope since you're kind of isolated for your protection, during this time, just want you to know I'm thinking about you, and I have some ideas," and they're kind of sharing some thoughts. And so these are, I'm actually right after this call going to deliver these to Hillcrest Health and Rehab. But go ahead, send us artwork, send us cards. We can work on getting pen pals going. But I think the biggest thing is just notes of encouragement and artwork that we can hang on their walls. And if you want to send puzzles or other activities for our seniors to do so that they continue to keep their minds engaged, that would be well appreciated. Those items could even be dropped off at the front desk of some of our facilities, but we really don't want people kind of out in the community these days, right? So letters@hillcresthealth.com is a great way to do that.
Jim, are there ways that you are communicating in the opposite direction? So obviously those folks who have loved ones as residents of yours, how are you kind of keeping them informed and updated?
Yeah, that's a great question. So the main thing is updating our webpage that we've created, hillcresthealth.com/COVID-19. And so on that page, we, right from the very beginning, put on what our restrictions were going to be in all of the different service lines, what we were doing to respond, how we've changed our cleaning schedules, and the way we're doing all those things. And with that page, we continue to keep it updated anytime there's a change. If we just changed up how we're doing dining services, then we will, we put that information on there. And then in addition, we have for family members, we've got letters going out, and I'm actually starting to work on a video right now from our chief medical officer so that we can get some information out to our families and to the public. We put a lot on our Facebook page, doing a lot of communication through our different social media channels. And then one of the most important is just to stay in touch with our team members. They need to understand what we're doing from a leadership standpoint. So on the front lines, they know how to provide the treatment. And so for that, we've had a message from our CEO that we recorded and sent out to everybody to their home email addresses as a YouTube video. We have a call that's recorded on our voicemail system. And so every couple days, our chief medical officer updates the latest information. We put on the numbers of cases in the area and kind of what we're doing about it. And so they have that phone number and they can call in anytime and hear the updated message. So it's been all about communication. And for me, as much as this feels like a crisis situation, which, in my PR background, I'm used to, crises and communication, but I'm used to them being over pretty quickly. And this one's potentially go on for months. So it's kind of a feast or famine kind of thing for a PR guy.
So you did take the leadership Sarpy, and we did do a full day on crisis simulation. So, and so it looks like you are doing a great job sharing that information, because it's channeling through our office. And so thank you for that. And I did see a Facebook video where an adult was visiting their parents, sitting outside the window on the cell phone, talking to the person that's in the senior living. And I thought that was pretty clever, that like, we can't be inside the building, but I'm going to stand outside.
It's been pretty common.
Yeah,
it's been pretty common, so they can at least see them and have some interaction, and then they talk on the phone. And yeah, there's even, I saw another picture of somebody putting painter's tape on the windows and their granddaughter's on the other side, and they both have dry erase markers and they're playing tic-tac-toe through the window.
Oh, that's great. So, that brings up another kind of aspect now, because we talk about having activities and stuff. Are the seniors specifically going outside and getting some walking in, and what is kind of that conversation looking like? And that's kind of a tough one.
Well, the difficulty with that is, especially the nursing facilities, we're trying to not have interaction through the hallways and outside.
Yeah.
And trying to be careful so that there isn't any cross-exposure, contamination,
Right.
anything like that. So people have been pretty much kind of, hanging out in their rooms and things, and we're bringing the activities to them.
That's great. That's great. Kevin, do you have any additional questions?
Well, just another ask, and if you could share, Jim, I know you've had conversations with Karen and myself in regard to looking for some resources for additional hand sanitizer, et cetera. What are some other ways in which kind of our members can support you as a fellow member?
Yeah, I appreciate that. I mean, our biggest need right now is hand sanitizer. There's just a national shortage. In fact, one supplier, we thought we had just found out that there was an opportunity to get some. We tried to jump on it, and they sold out 1.2 million bottles in 30 minutes.
Oh,
So
gosh.
we missed that opportunity. It's been that crazy. So we are trying to figure out any way that we can to get it. Obviously, washing hands is the #1 way to deal with the virus and to keep people safe. So there's plenty of soap out there, and so we're continuing to go that route. But it is a little bit faster and easier if some of our team members do have that, especially for our home care and hospice team members who are going from house to house and being able to protect them when they leave a house and get in their car, being able to have that sanitizer. So definitely looking for that. And then we're trying to just gather as many masks as we can. As you know, there's a national shortage, and people have even resorted to making them. And we've had people reach out saying they're willing to make masks. And we certainly welcome that opportunity. So
that's good to know.
Please let us know.
I know there are a lot of folks making masks, and a lot of those folks, I think, are looking at first responders and at the more traditional hospital settings. So knowing that you're in need of those as well is helpful information.
And
yeah, they've gotten to the point where the government's saying you could put a bandana over your mouth because that's better than nothing. Yeah. But I mean, if we can get a handcrafted mask, I'd take that over looking like a bank robber any day.
So hand sanitizer, masks, toilet paper's doing good?
Yeah, we're still good there.
Okay, good. And so we want to encourage everybody that would like to help support the people that are living in your facilities to reach out to letters at hillcrest.com.
Hillcresthealth.com.
Yep. And so if anybody has any additional questions, they can surely reach out to Kevin Hensel at the Bellevue Chamber or myself, Karen Gibler at the Sarpy Chamber, and we'll make sure that we can share this information with Jim. As you're, right in the front line right now. And so we'll go ahead and just help communicate any of that stuff through you, or they can reach out to your offices, I'm sure. So you have many locations.
Yeah, I appreciate that. So certainly the letters at hillcresthealth.com, great opportunity. We've received over 250 emails so far with tons of artwork and things. But I just want to thank you guys. The chambers have been so supportive of us. We've got 5 campuses in Sarpy County and in both Bellevue and Papillion communities. And, you guys have just been great. And I appreciate all the support. Thank you.
Yes. Okay. Well, have a great day, Jim, and thank you. And Kevin, you have a great day as well. And we'll talk to both of you gentlemen soon.
Thank you. Thanks, Jim. Thanks, Karen.
Thanks.
Yep, you bet.